This is a product demonstration of the Talley Venturi portal drain and foam wound care set application technique, using a model of a grade 4 pressure ulcer with exposed bone. There are a number of factors which need to be considered prior to application: the peri-wound skin, the depth of the wound, the underlying structures, and finally the application of the treatment. Firstly, looking at the peri-wound skin, if there is broken skin, red skin, or friable skin, it is recommended that some form of barrier protectant is applied. These may come in the form of a hydrocolloid dressing, a film dressing, a gel sheet, or a liquid barrier film. Once the peri-wound skin has been examined, you can then decide on the treatment which you want to apply. If the skin is intact and viable, it is not always necessary to apply any of the barrier protectants mentioned. The peri-wound of this wound is healthy and intact, therefore no barrier protectant will be applied. In this grade 4 pressure ulcer, there is an area of exposed bone. The exposed bone and any underlying structures, for example tendon, fascia and sheath, must be protected with a non-adherent contact layer. Ensure that the edges of the non-adherent contact layer are within the wound margins. Any contact layer can be used. Please check your local protocol or formulary. The non-adherent contact layer should be cut to size to cover the underlying structure and placed gently in the wound. The wound is now ready for the wound care set to be applied. The Venturi portal drain and foam wound care set comprises a portal drain, a foam pad, transparent film wound dressing, and a measuring tape. The length, width, and depth of the wound should be measured, and the foam cut to size to allow it to be placed gently into the wound. Once the foam is cut, gently rub the foam edges to remove any loose pieces of foam. Do not cut or rub the foam over the wound. Gently place the foam in the wound cavity, covering the entire wound base, sides, and undermined areas. If the wound is large, more than one piece of foam may be required. If more than one piece of foam is used, ensure that all adjoining edges of the foam are in direct contact with each other to ensure an even distribution of negative pressure. The total number of pieces of foam used should be counted and recorded in the patient's notes. Place the transparent film dressing over the filled wound, ensuring contact with at least 2.5 centimeters of intact skin beyond the wound edges. Lift the transparent dressing lightly with the thumb and forefinger and cut an oval-shaped hole, approximately 1 centimeter in diameter, over the foam, taking care not to cut into the foam. Apply the portal drain over the area, ensuring that the hole in the portal drain aligns with the hole cut into the transparent dressing. Attention should be paid to the site of the portal drain and tubing to avoid placing over bony prominences or with increases in the tissues. Apply gentle pressure around the portal drain to ensure complete adhesion. Attach the portal drain to the Venturi power unit and canister by lining up the locator stud on the tubing connector with the notch on the canister, pushing down gently and twisting clockwise to lock. Turn on the power unit to initiate suction. Once the power unit is running, observe the wound site. The dressing should contract noticeably, becoming firm to the touch. If the dressing fails to contract, then it has not been completely sealed. To rectify this, reinforce the dressing seal and/or adjust the portal drain and initiate suction again. The dressing integrity should be checked every 2 to 3 hours and at every shift change, and these checks should be documented in the patient's notes. Depending on the patient's status and your clinical judgment, the initial dressing change should take place after 48 hours and then 48 to 72 hours thereafter. For infected wounds, the dressing may need to be changed initially every 24 hours.